This is my radiation monitoring device called a dosimetry badge. It's a sensitive piece of monitoring equipment that contains a small film wrapped in a light-proof envelope that tracks the amount of radiation exposure. We obtain our readings quarterly by sending our badges out to a company who measures the amount of radiation obtained by each individual badge. Each employee should wear their own personal dosimetry badge anytime they are performing or assisting with a radiograph, and it should be worn outside of a lead apron at the thyroid level. The MPD for vet staff annually, according to the NCR, is 5,000 millirems. A dosimetry report, I'll show you an example of one here in a moment. This is a dosimetry report, so if I want to find what my readings are for the year, I simply find my name, Brianne Coy, and I go to the column labeled dose this year, and I can see that it says ND, meaning not detectable. So that means I am well under the MPD of 5,000 millirems per year for this year. PPE to be utilized in the radiology suite. That includes a thyroid collar, a lead apron, gloves, and eye protection, as well as the dosimetry badge. They all should be lined with a minimum of 0.5 millimeters of lead or equivalent. And you always want to visually inspect the gear prior to wearing it. You want to look for things like holes, cracks, bite marks, or anything of that sort that would compromise the ultimate goal of the PPE, your safety, and the ALERA principle. So I'll go ahead and I'll check my gear now prior to putting it on. So I begin by putting on my lead-lined apron. Next, my thyroid shield. Attach my dosimetry badge. And finish by putting on my lead-lined gloves. All set. 3 methods of restraint utilized in veterinary radiology include physical, non-manual physical, and chemical restraint. Physical involves involves having personnel present in the room, using themselves to help hold the patient in position. Non-manual physical restraint involves the use of devices such as weighted bags to help hold the patient in position. And chemical restraint involves the use of sedation or anesthesia to help ease patient positioning. 3 positioning devices utilized in veterinary radiology include things like a V-trough. This is useful when trying to place a patient into DV or VD recumbency. It helps to keep them more properly aligned. Foam wedges or foam pieces, those are useful to place under limbs or different parts of the body to help keep it more parallel with the cassette. And rope is another device that can be utilized to help extend and maintain a body part in the proper position for a radiograph. Physical protective barrier that can be utilized in the radiology suite would include lead-lined walls. For example, if my patient were sedated and properly positioned for their radiograph, I could simply step out of the room, take my exposure, shut the door, and that would thus nearly eliminate my risk for radiation exposure. Distance, you always want to distance yourself as far away as you can from this primary beam. As the law of inverse square states, as the distance between the beam and the staff member is doubled, the intensity of the primary beam is decreased to 1/4. And really taking the quickest exposure as possible, that really decreases the amount of time that you're exposing yourself to the radiation. No portion of any human, shielded or unshielded, should be exposed to that primary beam, because even if you're wearing a lead-lined glove and you place it under that primary beam, you're only decreasing your risk of exposure to radiation 25%. So you can imagine how much exposure you're placing yourself in if you have just your plain human hand or any other body part exposed under that beam. And non-essential personnel should always be removed from the x-ray suite during exposures, just to avoid any unnecessary radiation exposure to that person or persons. And you always want to make every effort to obtain diagnostic images on the first exposure, because once again, that's reducing the risk of exposure you're putting towards yourself as well as the patient. And persons who are under the age of 18, they are not permitted to perform radiographs because the MPD, the millirem exposure for their age, is just so low. And pregnant women, now they must report to their supervisors when they're pregnant. They must notify them. But they must really be careful, because during the first 4 months of pregnancy, that fetus is really susceptible to the harmful effects of that ionizing radiation. But if the pregnant woman chooses to continue with the radiographs, her MPD for the entire pregnancy is 500 millirems with no more than 50 millirems per month. In preparation for any x-ray, we make our x-ray labels on our Cornerstone software on the computer using the same template each time. So I'll zoom in here so you can see what I'm going to be doing here in just a moment. This is our x-ray label template. And all I must do, I just enter in the exam portion just the area of interest, the area that we're focusing on. So this is going to be craniocaudal, and I use the abbreviations for the radius and ulna. And then I also change the operator to my initials, since I will be the one performing the radiographs. But each time you can see it pre-populates the clinic information, the patient information that you have the x-ray label selected under, and also the date. Okay, I've chosen the correct cassette size for my cranial caudal radiograph of the radius and ulna. So I'll place that on top of the tabletop. And we have a sedated cat here I'm going to use for the radiograph. So I'll just place them in sternal recumbency. And I want to make sure that I center at the midshaft of the radius and ulna. And his head cannot be in the radiograph itself. It's not really quite centered yet. What I'm going to do, move it down a little. That's pretty good. And then my collimation, it only has to include to the distal carpus, to the proximal elbow, with the radius and ulna being the lateral borders. We'll move them over just a little bit here. Yeah, looks pretty good. And I'm also going to use a rope to help hold the leg into position. And then also in my radiograph, I'm going to put a lead marker, has the letter R, and I'll put it to the right of the radius and ulna. So I do have my proper PPE gear on. You can see I have my lead apron, my thyroid collar, dosimeter badge. I'm now going to put on some lead-lined gloves. And what I'll do now, I'm going to have Kelsey, my colleague Kelsey here, she's going to come in and measure with some calipers. And she's going to measure right at the mid-shaft of the radius and ulna, so right there along that line. We are at about 2. Yeah, so we'll go ahead. We measured at 2 centimeters. Let's see, my little right label is slid over a little. So, yep. So I've already preset the machine to the radius and ulna view. So Kelsey just inputs the 2 centimeters in. And that changes our KVP to 42. And our mass is 4.2. So now I'm just going to double check. There's no human parts in the primary beam here. Actually going to shorten my beam a little bit here. That's pretty good. up a little here. Okay, I'm going to be creating the label for our VD thorax view. Once again, we're going to be using Blue Ivan. So I'll zoom in so you can see what I'm doing here. Once again, on our Cornerstone computer software, got our x-ray template up. So I'm just going to change the information for this view here. So I already pre-populates, the patient's name, the clinic information, and the date. I'm going to put VD thorax as our exam portion or our area of interest, and I will change my initials as I am going to be the operator. I've selected the appropriate size cassette for our VD thorax view, so I'm going to go ahead and load the cassette in the bucky tray here. We're going to be performing it on a sedated cat. So what I'm going to do first, I'm going to get Blue here all positioned. I want to make sure the beam is centered, just caudal to the scapulae here. Just kind of centered right at the caudal border of the scapulae. And then my collimation, I want to make sure that I include cranially up to the thoracic inlet. To caudally, I want to include the first lumbar vertebrae, and my body walls are going to be the lateral borders. I don't have my proper PPE gear on right now. I'm going to put on my gloves in just a moment after I change the collimation area. So I'm going to say roughly, include that. Whoops. So a little bit more here. Oops. Here. And then I'm going to put my lead marker here. I have a right lead marker. I'm going to put it to the right of the right axilla here. So now I'll put on my gloves. So that'll complete all my PPE gear. You can see I have my gown on, my lead gown, my thyroid shield, my dosimeter badge. And what I'm going to do next, I'm going to have my colleague Kelsey come in here and she's going to measure with the calipers. We're going to measure at the highest area, which it'll be right about where those crosshairs are. Kelsey, if you want to measure. Let's see, what do we get here? Okay, we get 9 centimeters. So what I'm going to have Kelsey do, she's going to go over to our machine and she's going to input that measurement. I've already preset the machine for a VD thorax view. So what that does, it pre-populates our our KVP to be 46, and it pre-populates our mass to be 4.2. So once I'm certain everything looks perfect, I'll go ahead and I'll take the view here. It's okay, Blue. It's okay. You're okay. That looks good. Make sure I got my arm. Yeah. And we're going to wait just a minute. One of the other important things you want to do, it's okay. You want to make sure that when you're taking a thoracic view, you want to make sure that you take the radiograph once the patient inhales. It's okay, Bluey. It's okay. You're okay, Blue Blue. Now that I've chosen my appropriate size cassette for the VD pelvis view, I'm going to go ahead and place it in the bucky tray. And we're using Smokey, a sedated canine, for our radiograph today. So what we're first going to do, now that my colleague and I are wearing our appropriate PPE gear, we're going to get him positioned. So we'll place him in dorsal recumbency, and we're using a V-trough on the thoracic area here. Good boy. Okay, perfect. Okay, so I want to make sure that I center the beam at the ischial tuberosities. That's pretty good. And my collimation is going to extend from the cranial ilium to just, or to the distal patellas, with my lateral borders being the greater trochanters itself. I think I might actually slide this down. That looks pretty good. Okay. So I'm also going to use these weighted foam blocks here to help hold the hind limbs parallel to each other. And for the hind limbs, I also want to make sure that I extend them fully. And I want to keep them parallel to the table as well as each other. And the stifles, when I hold them, I'm going to rotate them medially so that, once again, they're parallel to each other as well as the table. I also want to keep the tail aligned and centered with the spine. And the patellas, I want them centered over the trochlear grooves. So what I'm doing now, I'm getting some tape ready because I'm going to use some tape as well on the hind legs to help keep them closer together. Get a little bit higher. Oops. Whoops. Okay, I'm going to work a little bit more actually. Smokey has a lot of hair, so this makes it a little difficult with the tape, but it does help. Okay, so I'm going to put my other weighted foam block here, and that'll help. Okay, pretty good. Tail, I'm going to tape down this tail too. So before I put on my gloves, I'm going to measure at the thickest part of the pelvis here. And I get about 10 centimeters. So what I'm going to do now, I'm going to come over to the machine and input my measurement. I've already preset the machine for a VD pelvis view. So when I set it to 10 centimeters, whoops. That makes our KVP 56 and our mass 4.2. Okay. So Dr. Hendrickson is going to extend the forelimbs cranially. And I'm going to make sure these hind limbs are in full extension here. Make sure everything looks perfect. One last thing. I also want to make sure that my lead right marker is just to the right of the cranial aspect of the pelvis here. Processed films are placed in their own individual folder here of the proper size. And on each folder, we affix a label in the top left corner that reads the exact same as the label imprinted on the film. And for our library here, we store things based off of date. So our most recent exposures are filed at the very right corner. So with this being taken today, I'll go ahead and file it. This far right corner here. And if you ever want to access a patient's radiograph, you simply check in their computer history, see when their radiograph was taken, and then you search for it in the library here based off of the date. For our films here, when we have unexposed film that's still in the manufacturer's packaging, we make sure we place it in an upright position next to our processor. Once we open the package of film, then we of course place it in our film bin, which is down, down here. But the key is you do not open the new package of film, or you do not open that film bin until the integrity of the darkroom is up to par. So make sure there's no light coming through any cracks, anything. The only light that can be on is the red light up above. And we do not open a new package of film until we've completely gone through the film in our film bin already. We'll now be performing a contrast study. It's going to be an upper gastrointestinal contrast study on a cat, and we're going to be using a barium suspension to evaluate morphology. So we have Chance here. He's fasted for 12 hours. Poor Chance had an enema yesterday evening, and as well as about 2 hours ago we gave him another enema. So we've already completed his survey radiographs, so I already know exactly how I want to position him. I know my collimation, how I want that to be set up. I also know my measurements for both the lateral and the VD images. So we're ready to begin giving him the barium sulfate suspension now. And he's going to get approximately 65 mLs. So Kelsey here is helping me out, and she's holding him for me. Good boy, Chance. Good boy, good boy, good boy, good boy. Good boy. Good boy. Good boy. Okay, so now Chance is ready for his first x-ray here. It's going to be his 0 to 5 minute radiograph here since we gave him the barium suspension. So I'm going to place him in a right lateral recumbency. And I might have Kelsey here come in and help me just to position him. So if you grab his front legs or his back legs. Perfect, thank you. Perfect. Okay, let me grab these legs. Perfect. Okay, now I'll have you hop in on the end. So I already preset the machine to 8 centimeters. That's what we calculated from our survey radiographs. So that puts our KVP at 52 and our mass at 4.2. So I'm just going to make sure everything lines up here in the collimated area. I got both my lead marker for the right side and my 0 to 5 minute marker here. Oops, Kelsey, do you mind hitting the light once more? And I am going to take the radiograph when he exhales. Perfect. And now we're going to go ahead and we're going to do the VD radiograph as well. Now I finished the rest of Chance's barium contrast study, focusing on the upper gastrointestinal tract. I know you see me demonstrate on camera doing the lateral view at the 0 to 5 minute marker. After that, I did a VD view of him as well, and that's what I did each time. At each minute marker, I did a lateral and a VD view. So after the 0 to 5 minute marker, I did one at the 15 minute marker, the 30 minute marker, 60 minutes, and then I did it next at the 2 hour mark, which you really can do after the 60 minute mark. You can do it every 30 to 60 minutes. And you stop once you notice the contrast or the barium reach the small intestine. For Chance, I ended up stopping at 2 hours and 30 minutes just to kind of see where things panned out for him. But I'm going to show you in order the radiographs I took for him, the rest of them. Just zoom in a tad bit here. So this one here, this is his lateral x-ray at the 5 minute mark. It may be a little bit hard to tell on camera what my labels read, but it does say 5 minutes, and I also have the right marker as he was in right lateral recumbency. And then also on each film you can see that I have my patient label, excuse me, or with the information as well. We then had the VD view at the 5 minute mark. And it may be hard to read these as well on camera with the minute mark, but at each interval I did note what time frame we were looking at as far as how long it had been since giving the barium. We have the lateral 15 minute marker. Oops, We have the VD 15-minute mark. We have the lateral 30-minute mark. It's pretty neat to see the barium work its way through the gastrointestinal tract. Excuse me. Sorry about that. We have the VD 30-minute mark. Lateral 45-minute mark. VD 45-minute mark. Excuse me. Once again, we have a VD, and this is of the 60-minute mark. And Chance's spine definitely could have been a lot more straight. I know by this point he was getting a little fussy with things. So we'll definitely work on that in the future. But in all honesty, he was a trooper throughout the whole procedure. Okay, we have the 60-minute mark, lateral view. And really by this point, we're noticing the barium. It's really reached the small intestine, but it's still good for the sake of learning. We really kept through the whole process. That's right. Sorry. We had the lateral 2-hour mark. Try to zoom in once again here on the labels. Sorry. 2-hour, the right marker. Okay, we have the 2-hour VD. So by this point, we would be fine to stop, but I'll show you my 2-hour, 30-minute view as well. There you go. And that's the lateral, of course. And we have the VD view. Excuse me. There we go. And that completes my contrast study.
Hello, this is Dr. Hendrickson, Hospital Director of the Norwalk Veterinary Medical Center. I'm the preceptor advisor for Brianne Coy, who's a student in the radiology course VTHT 1345. She is in section 31421, and the instructor for the course is Stacy, Gregoire, LVT. I will be assessing Brianne's radiology skills for the part of this course. And this is Chance, Brianne's subject for the barium upper GI series, and he will be giving his input at the end. Brianne's strengths include being very thorough, precise, and methodical in her approach. She's very good with preparation, including the paperwork, the patient prep, and personal protective equipment. She's caring and considerate in handling of the animals. Her weaknesses, while minor, are primarily patient positioning. She will continue to benefit from more experience and practice taking radiographs to increase her skill level. Her knowledge has progressed during the course and has given her a wider range of access to techniques and types of views and different types of animals to work with doing radiography. Additionally, the course worked well with the timing of our Ohio Department of Health 3-year radiology inspection. It gave Brianne, by having participating in the course, a deeper appreciation of what was involved in the preparation for our Ohio inspection. Chance, do you have anything to add? He gives his paws of approval. Thank you.